Governor Holcomb's briefing will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you can click the Raise Your Hand button. When you are called upon, we will unmute your microphone, and then you also will have to unmute your microphone.
Good afternoon, Hoosiers. Thank you for joining us today to get some updates from Dr. Dan and from Dr. Box and others that may be called upon. Let me just say here at the outset, before I do kick it over to Dr. Box, that Indiana is largely holding steady. That's a good thing on our 4 principles. You will take a deeper dive into each of those respective quadrants, if you will. But having said that, we have seen somewhat of an uptick in our daily positivity rate. That's something that we track very closely. It was up slightly, but not to the extent that we've seen in some other states around the country and even some very close neighboring states to us. Although there were 2 days, I guess, back-to-back within the last week, where we were over 500 positive tests statewide. So that was something else that we looked at, again, back to that positivity rate. And we've seen a slight or an uptick, an increase in our hospitalization rate, which is another thing that we're paying very, very close attention to. But again, not to the extent that it has threatened our overall capacity to care for those who are in need. So that said, all in all, we are managing our way through this, which has been the goal from the very outset. Folks have noted and called in other states around the country that are shaded a different color, maybe redder than we are, and each for different reasons, I suspect, but they're not experiencing the same results, and we can maybe get into that as well later on in the hour. But it's just fact that other states, the majority of them, have seen an increase, and we pay attention to what happens around us, not just inside our state, but around us. And some states, as I alluded to, are experiencing surges, or in some cases, resurges, so to speak. The nationwide positive cases collectively are at a peak level, primarily in some certain areas, but again, across the whole country. And so that just underscores the fact that what we've said every week, all of us, that this virus is on the prowl. And in some places, it's gaining momentum. It's not slowing down. That spread is not slowing down. It's just doing the opposite. And that's why you see a number of states that are actually even though they've maybe reopened recently, they're now going back and closing some of those facilities or closing parts of their economy. We don't want to find ourselves in that situation. And so understanding that July 4th is right around the corner, where we celebrate our independence, we wanted to make sure that we were all on the same page going into this weekend as we were looking to go from stage 4 to stage 5. I'll just say, having prefaced this, knowing all of the information that we're taking into account, knowing that a date doesn't drive us, but the data does, we are prepared over the next 2 weeks leading up to July 18th to go to stage 4.5, which means much will stay the same over the next 2 weeks. Some things will change, especially to get general about it, indoor, outdoor activity. We just have to accept the fact, more than recognize it, but accept it, that again, this virus is on the prowl and it is moving. And it's moving even within our borders in different counties in our state, different positivity rates. And we are living on virus time, so to speak. And so we're taking that into account. All we try to control is what we can control, our own action, our own behavior, our own conduct. We know that there are things that we can do to slow the spread, especially as we await therapeutics and a vaccine. But the volatility that we see, even in some areas of our own state, but especially around the country and especially around our own borders, is of concern. And that's what's given us pause to push pause in some areas. And so 53, I think, Rachel, 53 press conferences later, we will be back next Wednesday. You heard it here. I hope, well, I'll be back. I'm hoping you'll be back. We'll be back here at 2:30, same time, same channel. We want to make sure that we're providing you the updates, what occurs over the next 7 to 14 days. So we didn't take this lightly. We evaluated it at every angle that we knew. Now, so what does that mean? And we'll all get more into this, but just kind of on the surface, stage 4.5 means that our capacities, for the most part, will stay at the same level, stay at the place where they are today. But we will give the green light or the green flag to mostly outdoor activities, events that Hoosiers are going to especially enjoy, I think, coming up this weekend and this time of the year. Just as an aside, it was Dr. Dan that you shared with me some preliminary research on the spread of COVID outbreaks around the country, that the risk of transmission is up to 19 times less when outdoors compared to indoor activity. And that's true and supported by our own experience here. And when you look at where our large numbers were or our surges were, certainly they were indoor type activities. And so we took that into account. So if you're a local parade or if you're a fireworks show this weekend, as I know there are some planned around the state of Indiana, just be properly distanced. You have the ability to do that. And mask up. When you get into close quarters, this is how it spreads. We just know this. And we can take those precautions and folks can have a good celebration outdoors. So again, capacity would be on the limits for different businesses and entities that were opened up in stage 4 are holding steady at that same level where we are as we sit here today. That includes restaurants, that includes bars, nightclubs, entertainment, cultural facilities, event venues, bowling alleys, on and on. This is all on our back on track plan that can be pulled off the web. So that 250 number stays 250 for the next 2 weeks. leading up to July 18th. But again, we'll be back here Wednesday, and then obviously providing updates before the 18th as well in that second week. Personal services and gyms, fitness centers continue their operations again at the same level as we sit here today. But not to repeat myself, but fairs and festivals, similar events, they're going to move forward as long as they make the provisions on the ground to do it safely. And conventions may resume as long as they adhere to previous guidance that is, again, on that back on track. Everything is compiled in one spot that we've provided for single site and multiple site events and venues. Again, I would just encourage everyone to go to the back on track, because we've extended this, not gone to 5 for the most part, but 4.5. And lastly, just a little commentary here in leading up this past week, as we were all discussing this day in and day out, wanting to be safe and not sorry, wanting not to find ourselves looking back thinking, our gut told us to do this. And we're talking about the new normal that we find ourselves in, this uncertainty, this area of uncertainty. It's really not the new normal to me anymore. It's really the next normal. Things will change next week. They will change next month. They will change next year. Maybe the same virus. It may mutate, as we've talked about before, right before our very eyes. But we have to be prepared, and we are, and structured, and conduct our affairs to be ready for that next normal, whatever it may be, and scale up to address the surge as they come. So for the most part, this gives all of us a little more additional time to manage our way through this. I said at the very outset, probably the first week, that I wanted Indiana to be through this the safest and swiftest and surest way possible. And to date, that's how we've conducted our affairs. So you'll notice, we'll have some campaign stuff to talk about, including masking up, some information that we're going to get out. But if you could, Dr. Box, first, maybe give the supporting evidence on how we arrived at this, going through those 4 principles and some other updates.
Sure. So, thank you, Governor. Well said. Good afternoon, Hoosiers. Today, we reported 371 additional cases of COVID-19 in Indiana, which brings to our total 45,952 the total number of Hoosiers known to have COVID. We also saw 8 additional confirmed deaths. To date, 2,456 Hoosiers have died of COVID-19, and another 194 are believed to have died from this disease based on their clinical diagnosis. We also have seen nearly 490,000 Hoosiers tested for COVID-19, up from 432,000 a week ago. I do want to clarify something that I said last week. The total number tested on our dashboard represents unique individuals. Some people have had more than one test. So what you see is the number of Hoosiers who have been tested for COVID-19 at least once. I want to remind Hoosiers that testing is available at 200 sites across the state. You can visit www.coronavirus.in.gov to find a site near you. Anyone can be tested for free at one of our state-sponsored Optum sites or our state-run drive-through without a doctor's order, regardless of your symptoms. Other sites may have different requirements, and those are all spelled out on our testing map on our website. I especially encourage anyone who thinks that may have been exposed during a group gathering where social distancing wasn't occurring and masks weren't being worn to consider getting tested. I'm now going to hand things over to Dr. Dan now for some important updates for our long-term care facilities.
Thank you, Dr. Box. Thank you, Governor Holcomb. I want to take a few moments to give an update on cases in nursing homes, visitation, our testing initiative, and some planned changes to our reporting. Let me start by talking about outbreaks. So from a peak that occurred in late April, we have seen marked decreases in COVID outbreaks. Weekly cases reported to us have decreased by 77%, and weekly deaths reported to us by 83%. There are a lot of factors that have likely contributed to this. the early use of our strike teams, targeted testing, infection control, PPE prioritization, and close collaboration with the nursing homes themselves are examples of things we implemented early in this pandemic. Our surveyors have also been active throughout this pandemic, providing on-site help with infection control and cohorting. And I'll also give them a shout out by mentioning that they have now completed 100% of the required CMS infection control surveys a full month ahead of the required deadline. No doubt, the behavior of Hoosiers has also contributed to the decreases we've seen. By decreasing community spread through social distancing, washing your hands, and wearing masks, fewer nursing home staff were exposed and unknowingly went to work with COVID-19. This early success has also allowed us to start to loosen visitation restrictions. On June 3rd, we were one of the first 2 states to allow outdoor visitations to occur at facilities without active COVID. We've also permitted the return of essential family caregivers. We are now reopening facilities to salon care and other personal services and are developing the plans to resume indoor visitation by mid-July, and for some facilities as early as July 4th. For this to be possible, though, we need the help of everyone in the community. While the risk of dying from COVID-19 is low for people 19 to 30 years old, the risk of spreading it is high. Someone who does not practice social distancing or wear a mask in public and is exposed to COVID in the community risks more than their own health. For instance, if they visit a friend or family member who, like over 60,000 Hoosiers, works in a nursing home, they risk causing an outbreak. An outbreak that risks more than just the physical health of the residents in these facilities. Outbreaks may also prevent visitation. While restricting visitation was a necessary early step in preventing the spread of COVID-19, it has had a serious impact on the health and well-being of the residents. Families and residents have waited patiently through this pandemic to be rejoined. We must now do our part to make sure that this happens. Another important way of preventing outbreaks is testing. Because COVID can be carried and transmitted by a person who has no symptoms, it's important to identify workers in long-term care facilities who may have COVID and don't know it. And this is why we early on included working in a nursing home, even if you didn't have symptoms, as an indication for testing at one of our free Optum sites. And it's also why CMS has recommended every state develop a testing strategy for workers in long-term care facilities. Our strategy, like all of our other COVID responses, will be informed by data. This is why in June we undertook our largest testing initiative to test all skilled nursing staff in the state. Partnering with Optum, the National Guard, our ISDH workforce, and the facilities themselves, we were able to oversee the testing of nearly 40,000 staff. And keep in mind, the number is even larger because many staff were excluded because they had already been tested just prior to the initiative, or they had had a previous diagnosis of COVID. We are now working with our partners at the Regan Streif Center for Aging Research and Fairbanks to do an analysis of this data, and that we will use this analysis to better inform us on who needs testing and how often. Lastly, I want to discuss our data and public reporting. Let me start by saying we are going to report facility-specific COVID-19 data. Because our data collection has focused up to now on identifying new cases in facilities, and it did not begin until April 10th, it's going to take some time to build a dashboard that will allow the public to search by facility and determine when COVID cases occurred, how many residents and staff died, how many have recovered, and the demographics of those involved. For the creation of the dashboard, we will be taking a similar approach to the one we used with our hospital data. The first part of this will be requiring all long-term care facilities to give us an accurate and comprehensive list of all of the residents and staff who have developed COVID and when those cases occurred. And we'll require this reporting to us to go back to March 1st. And once we have this information by mid-July, we will make it available in a preliminary form to the public. But we're also going to use this data to build out a dashboard with the expectation that, barring any unforeseen problems, it will be publicly available 2 to 4 weeks after the release of this preliminary data. And it's going to take some time, but that time is necessary to follow the process so that we can have an informative and updatable interactive public dashboard moving forward. So why are we doing this now? So as we've stated from the beginning, we have been focused on early identification and mitigation of COVID outbreaks in long-term care facilities. And at the peak of the pandemic, we focused our resources on testing and infection response. We've also focused communication on getting the information that's necessary to families to make sure that outbreaks were communicated to residents and their representatives. And throughout this time, we have supported facilities and local health departments' rights to publicly report their data on their own web pages. Recently, both the largest associations that represent long-term care facilities and AARP, who advocates for the residents in these facilities, have expressed their support of providing facility-level information. As we have all learned, responding to this pandemic requires us to continually evaluate our approaches and, when appropriate, to change them. This is one of those times.
Thank you, Dr. Dan.
Thank you. Throughout this pandemic, we've been monitoring a lot of data surrounding COVID-19 to help inform our decisions. So now I'll get to the data, Governor, that you wanted me to give. The analysis focuses on the 4 guiding principles of our reopening plans: the number of hospitalized COVID-19 patients, our hospital's ability to treat a surge of patients, the ability to test all Hoosiers who have symptoms of COVID-19 or are close contact of a positive case, and the ability to contact trace all cases. As you can see in the next slide, our hospitalization numbers had trended down until about the last week or so. On April 8th, we had 1,749 people who were hospitalized with COVID-19. We had a low of 595 on June the 26th, but numbers have once again increased. As of today, 668 Hoosiers were hospitalized with COVID-19. And as of June 25th, we are seeing about 33 new COVID patients being admitted every day. As I mentioned earlier, our ICU beds and ventilator capacity have held steady. Ventilator capacity has been hovering around 40% for the state, and ICU beds have been over 80%. We also have seen significant increases in testing of individuals, especially within the past 8 weeks. We always see declines over the weekends, but the overall numbers have increased significantly. Another of our guiding principles has been contact tracing. As you may recall, ISDH launched a centralized contact tracing program in May. To date, more than 650 contact tracers have been hired and trained. An average of 345 citizens are calling the State Department of Health contact tracers each day to provide information about their case. 75% of people who test positive are successfully reached by our contact tracers, and of those, 85% are interviewed within the first 48 hours. We're making 2,500 daily calls to people who have tested positive or their close contacts. And we continue to scale up as needed so we have the ability to contact trace all Hoosiers who need it. We continue to do this in close conjunction with our local health departments. But we need your help. We need Hoosiers to respond to the contact tracers and provide information about others that they may have exposed. There is still a percentage of individuals who test positive who cannot be reached because their phone numbers aren't correct or who won't respond to the contact tracers. I'm asking every Hoosier to do their part to help keep COVID-19 under control and to respond to contact tracers as we reach out. We know that as people get out and about, we will continue to see more cases. We've seen cases increase in parts of the state, like Elkhart County, where we've seen 400 new cases in just the last 7 days. And we've seen what's happening in states like Florida, California, Texas, and South Carolina, which are seeing their highest 7-day averages of cases, and in many cases, are pausing or rolling back their reopening by closing bars and gyms and restaurants and continuing to prohibit indoor dining. So that's not where we want to be, Governor, going forward. This is back to you.
All right. Well, one area or one thing that we can do to not find ourselves in that situation. It's just one of many, but this is one thing that we know works, is to mask up. And I've had a lot of conversations with a lot of different people, and sometimes I get, well, it's just inconvenient. Well, it's not really. It may be inconvenient, but it's very important, and it works. And this is one of the tools that we know that can limit the spread. It's just factual. And so, inconvenient or not, this can save lives. This can save our healthcare network's capacity to treat people who actually are in need of that treatment. And so we are not just asking, we're recommending in the strongest terms possible that you think about not just your own life, but you think about those who you love, those who you don't want to lose. And we have started a little campaign here about masking up, about it's not just about me, but to try to stress it's about someone else, equally so. And it's about getting through, all of us getting through this in the safest manner possible. So with that, I'm going to mask up, and I think we've got a couple videos to show.
I wear my mask for my daughter, my family, and my patients.
I wear my mask for child welfare workers.
I wear my mask for my parents, Tony and Carol.
I wear my mask for my daughter, Courtney.
I wear my mask for my wife.
I wear my mask for my mom, Barb.
I wear my mask for my parents.
I want to ensure that my family is protecting yours.
I wear my mask because I've spent my entire life protecting others.
I wear my mask for Julia, my daughter, who teaches a boy with heart disease how to swim.
I wear my mask for Dr. Box.
I wear my mask for all of you. Will you wear your mask for us? Can't say it any better, can you, Governor?
That's exactly right.
I think that's awesome. Wearing a mask is one of the best things you can do to protect yourself and others. Remember that the Fairbanks study found that 43% of individuals who tested positive had no symptoms at the time they tested positive. So even when you feel fine, you could make someone else very, very sick. We've seen reports out of Michigan where nearly 100 people were infected after visiting a bar where masks were not worn and social distancing was not occurring. We've also heard about hairstylists in Missouri who were infected with COVID-19 but were wearing their masks. All of their clients were also wearing their masks, and not a single one of their 140 clients has tested positive for COVID-19. This is a perfect example of how masks can help protect you and others. If we're going to successfully return to a new normal, and I did say new normal, not the normal, where we can get back to those activities that we love, where every Hoosier needs to be wearing a mask and social distancing, and you have to take that to heart. I know it's an inconvenience and that masks can be hot in the summertime, but I promise you it's worth it because you might save someone's life.
Any more videos? Yeah, let's tee it up.
I wear my mask for my family and friends, and because I respect you.
Well, we're hoping more people get involved. You can go to the website and download your own poster and take a selfie and share why you wear a mask. We're using the hashtag #MaskUpHoosiers, and we want everyone to get involved. This needs to spread. This good example needs to spread faster than the virus. So, with that, I think we'll open it up for a little Q&A.
Sherry with the Indianapolis Star.
Good afternoon, Sherry.
Good afternoon, Governor Holcomb and Dr. Box. I appreciate that you gave us some insight into what data that might give you pause to move forward looks like. Can you give us some more sense of sort of where, is it just a matter of numbers trending in the wrong direction? Is there a level at which you start to think, I mean, especially seeing what's happened with other states, you want to stay ahead of the hospitalizations. You don't want to find yourself like Houston, I imagine, you know, kind of saying we don't have ICU beds. So are there metrics that you can sort of give for where you begin to say, okay, now is the time we need to just sort of pull back?
Yeah.
I think it was a question of, rather than pulling back, just not going forward as far as what we plan to go, right? We look around the United States and in the state of Indiana at our contact tracing, and we can see where individuals are getting infected and where they're infecting other individuals. Oftentimes that is in bars where individuals are not social distancing. It is in areas where we're inside in close contact. It is in big groups that are getting together. So really the purpose of this was to say, we see our numbers ticking up just a little bit, but we're not blind to what's happening across the United States, and we really don't want to be there. We want to continue to be conservative and smart about this. And we thought that looking at our numbers for another couple of weeks, helping to make the decision about how far we advance in another couple of weeks was more appropriate.
Yeah, and I'd just say that it's very just compelling when you see different counties. I used the word earlier, volatile. It's a very volatile environment out there around the country, and it is in the state of Indiana as well. We're not immune to that fact. And when you see, you know, hospitalization rates, or when you see that positivity rate going down, and then start to bend back up, and now it's starting to bend back down. We had a couple back-to-back over 500 positive cases within this last week, as I mentioned. But now we've had, our second or third here in Marion County, where we sit right now. Yesterday we had 0 deaths in Marion County, and this was a surged, area. Came in earliest. There's the most population density.
One of the best positivity rates in the state right now.
Yeah, and so that volatility. But if you go to a couple other counties around the state, it's a tale of two different cities. And so it's kind of a matter of when it gets there, in addition to what we're doing, how we are conducting our affairs to help slow that spread. And so I think, Sherry, that there is no, if you're asking for, if it gets to this percent, does that trigger retreating, pausing, or moving forward? It's not. It's a lot of different factors that all get put down together, and then you look over the last week, really 2 weeks, and you're always taking me out 21 days sometimes in different areas. So it's a number of factors.
Brock Turner, WFIU.
Good afternoon, Brock.
Good afternoon, Governor. Question here for Dr. Box or Dr. Raciniak. Not sure who's going to be best equipped to answer this, but I've spoken with several local health officials who have said they're frustrated with the quality of contact tracing coming from the state contracted tracers. Additionally, they say that they're still not getting data from the NBS database to merge with Power BI. The state's been managing this for about 2 months now. What's your message to officials who say that they're maybe losing confidence in the state's ability to manage this? And I will have a follow-up.
I'll take that, Ian. So I think that your point is well made. We did find that there were some lapses, that some individual local health departments were getting a direct feed from certain labs. So they were getting cases and names of positive individuals long before we were, and that there was a delay of anywhere from 24 to 72 hours before the State Department of Health was getting that reported in. And actually, some labs were actually hand entering that rather than using the feed that was set up. So that is one thing we've been able to fix. So that's something that if particular local health departments are having issues, I hope that you will reach out to us, because we've been able to solve that issue in several areas. The other issues that we've looked at with local health departments is that sometimes they have someone walk down from the police force or something and say, I've got a policeman who's positive. And so they want to be able to open that case up in the contact tracing and start entering that information right away. Right now, that case gets opened up because it is fed through our NBS system, and then that triggers an opening of a case that goes to our contact tracers. So we are working to change the data so that that is possible. We do have the ability now, our initial app for them to interact with the contact tracing platform, the Microsoft platform, was rather tedious and difficult to use, and so we have a new app now that is much easier. And so some of the local health departments that used that early on kind of gave up. And I would ask you to go back and interact with us. We've actually been going out with our individual epidemiologists that are regionally centered across the state and going into local health departments. I've charged them to go into every one and make sure that all the local health departments know how to use that. So those are hiccups, problems, concerns that we've been working through on a regular basis and are going to continue to improve that.
And I would just say, I don't know if Brock had a follow-up. Did he see? Brock, before you get to your follow-up, I've read clips throughout the country and around the world, for that matter, that some folks have kind of stepped away from tracing or said, we've got too much, we can't handle this, we got to focus over here. We're doing just exactly what Dr. Box said, is we're working to improve on this. And we're not walking away from it. This is an extremely valuable tool to be able to help us isolate those cases when we know where they are. And so appreciate the patience. I know you mentioned hiccups, but we're moving. I mean, we're over 10,000 calls or
we're
contacts.
Moving the needle, but I think that is, our contact tracing has helped us to identify industries, even in the Elkhart area, that we know have outbreaks, and that has helped us to be able to work with Elkhart and work with those particular businesses or industries to make sure that we're testing more individuals so that we can get them kind of back on track. And I know they are very, very comfortable with staying back in stage 4 right now. I know their mayors, their county commissioners, when I was up there on Monday, they were all pushing me to say, don't let us go to 5, we're not ready. And I respect that. I respect the fact that they put a mandate for mask use in their county. Their local health officer took a big step, and she's really had the support of the county commissioners and the mayors up there.
And she has our support. I mean, we want to help locals who are making the best decisions on the ground every single day. Brock, you had a follow-up?
I did, yeah, and thanks for taking the time to kind of walk through how you all have changed things and are continuing to amend that. Just one quick follow-up. Last week you said that contact tracing would be likely available this week. Any updates on that and any sort of, I guess, teaser on what we should be expecting on what that data looks like? I know we just got the long-term care facility data, but yeah, that would be helpful as well.
So the data I gave today is some of the best data that we have right now, but just as we're working to actually build that platform for long-term care facility reporting and residential facility reporting, we're doing the exact same thing and have been all along, and it's just been a prioritization thing. It's like, first of all, we have to connect all of our local health departments, make sure that they're comfortable with it, make sure that they can interact with the Microsoft Dynamics database, and that, I just said, we're reaching 75% of the positive cases. That means that there's 25% out there that aren't responding to our text, aren't responding to our email, and are not responding to our calls. So that is really where our local health department is critical. They're the boots on the ground to help us track those individuals down. They're the boots on the ground to help us make sure that they can connect individuals to resources when they need help to be able to quarantine and to be able to isolate. And they're the boots on the ground to help us work with, as I said earlier, industries, businesses, long-term care facilities that have outbreaks. So that had to be our first priority, but the other is coming along also.
And not to dwell, but the Fairbanks study shows us that we got a long way to go. I mean, we've got 90-some%.
Still got about 96% of Hoosiers that need to get infected or exposed to this. So there's still a lot of people out there that are at risk.
Tracing will be with us for a while.
Brandon Smith, Indiana Public Broadcasting.
Good afternoon, Brandon.
Afternoon, Governor. Afternoon, Dr. Box. I have a couple of questions that are along a similar vein. I'll ask the first one and then follow up with the second one. First, on the mask wearing ad campaign, you've been recommending the wearing of masks through this entire process. What do you think will change now?
Well, one thing I hope is that individuals watch the news every night and they see what's happened in other states where there hasn't been social distancing and there hasn't been mask wearing. And I hope that we start to take to heart that Indiana could very easily be in that same situation in the next 2 to 4 weeks or 6 weeks if we don't take this to heart. I think that the mask campaign is really meant to go out on social media where we can reach maybe some of the younger kids that don't watch this show every day and haven't heard us say this over and over again. They may not watch the news and hear Fauci or other people talking about masks. So, the point of that is to say, it really is about protecting other individuals, and it can give you some protection also. The CDC just on June 28th matched the WHO's recommendations that the public should wear masks in public, and I think that's a really important message for us to get out.
You had
yeah, thank you. When it comes to the pause that we're going to go into right now, or even potentially the need to reimpose some restrictions, do you think that the majority of Hoosiers who've been experiencing fewer and fewer restrictions over the last 2 months are going to be, quite frankly, okay and more importantly, cooperative if they have to go back under these restrictions?
Well, for the most part, they have so far, and we've appreciated it. And that's why we're in the shape, I think, in large part because of Hoosiers. Not only do we believe, you rightly used the word, I think, recommended, or our guidelines have suggested people to wear masks, or the campaign to wear a mask can be helpful. And I got to tell you, as I get around, absolutely. Do I see people not wearing masks? Yes. Do I see a lot of people wearing masks? A lot more today than I did a month ago or 2 months ago. And so it simply just can't be said enough. We know it works. I hope people don't look at it as inconvenient, but look at it as cool. Like, I'm doing my part, my patriotic duty to try to get us through this sooner rather than later. And so, just to be blunt, Brandon, yes, I do think Hoosiers, for the most part, see what we see. That's why we share it. That's why we're transparent about it. And I think when Hoosiers see that hospitalization rates are starting to tick up, when they see the positivity rates start to tick up, in some counties more than others, when they see states on our borders, when I'm talking to other governors and they're showing me hot spots, places where there are surges that they're concerned about, that gave us pause. And I don't want to, overstate it. We're still in a good position. Our healthcare system was coordinated at the very outset of this. And we were able to identify early on the ground and be able to test and trace, and we continue to ramp up those tools. And so, it's a lot of this has to do with our conduct, as I keep saying, but a lot of it has to do with our conduct. And other governors around the country are saying the exact same thing. They're pleading with folks to think about us, think about we, not just me.
Meredith, WLFI.
Good afternoon, Meredith.
Good afternoon, Governor. I have a couple of questions. So some other states who, like New York, New Jersey, were kind of at the peak of it. Now they're seeing a large dip in cases. They are mandating that people who come from some of these hotspot areas be quarantined for 2 weeks. Is that something you would consider? And then my second question is, why not just mandate wearing masks? You have the ability to do so. Why not just do that?
I'll go, and then I can read your expression. You have something to share. For right now, because I believe in Hoosiers, and I believe that Hoosiers are doing the right thing for the most part in terms of doing their part to help slow the spread. I think that is, again, one aspect of this all where we have acted appropriately. And And I'll just say, at the very same time, we have a long history, way before this pandemic, but we have a long history, especially in our health department, at FSSA, at the Department of Health, of working with locals in a partnership. And so, as Dr. Box mentioned earlier about Elkhart County, for an example, or it was Marion County before that, or Cass County before that, or we seek to support and help our local partners through this. And so if they deem that masks will slow the spread, if they're looking at those positivity rates really going up, then we're going to do all we can to be helpful. And that's got us to this point right now. Now, that's not to say in 8 weeks from now, we may be in a different situation, but we'll cross that bridge when we get to it. I know you had something to say.
Well, I think that what you said is exactly right, that we have always supported the locals and their ability to make the best decisions for their communities and their counties. And I think with St. Joseph County and with Elkhart both mandating the use of masks, the governor and I support that 100%. We would never not support that. And I think that whether your data looks good or bad, mandating masks may make a difference, but my concern is that sometimes it makes people almost more stubborn and stand their ground. You're trying to force me to do this, and I'm absolutely not going to be forced to do this. And realistically, what I'd like to say to Hoosiers, because Hoosiers always put other people first. I mean, I've seen so many times where Hoosiers think about what's best for their neighbors, and they're some of the kindest and most friendly people that I ever run into across the United States. My sister lives on the East Coast, and she's always talking about how she misses the friendliness here. So I think it's a part of making it not about myself, but making it about you, and recognizing that this is something you can do in this pandemic every single day when you go out. And I think it's also important that businesses can be a part of this partnership too. They can say, just like no shirt, no shoes, no service, it can be no mask. You can say, I want to protect my other customers who are in here. I want to protect the individuals who work in this facility, in this business. So I think there are a lot of ways besides mandating it that we can
And I
do
would
it.
say, I kind of glossed over this. We're going to try to lead by example here in the State House and in state government, the folks that work for the citizens of this state, and we're going to, in the public spaces on state property, we're going to mandate our employees wear masks. And so we'll try to lead by example. This is, it almost, after you do it for a while, it almost just becomes part of the culture, and you kind of feed off of, we're in this together. And it's not rhetorical anymore. It's actually the action that's getting us through. And Meredith, I think you had a follow-up as well.
Yeah, I was just wondering if, you are going to take any steps. A lot of other states have, people who are coming from hotspots to visit, states who have seen a downward trend in their COVID cases. Is that something you would consider if somebody comes from, say, Florida or Texas or something like that?
I do know individuals across our state that are already asking people to do that. If they come back from a particular hotspot, they live in a hotspot and they're coming, they travel by airplane. I think that's a really hard thing to keep track of and to enforce. And I think that, our borders, this virus doesn't respect any border, nor does, the ability to control I-70, I-65, and everybody that uses this as the crossroads of America. So I think that would be very difficult for us to do, but I think out of respect, especially if there are high-risk individuals that you want to be in contact with, that's a very, very good plan.
Yeah, and I also think this question, Meredith, underscores what we go through every day where, yes, we look out long-term, but, we're looking at every day between now and not just July 4th, what would have been July 4th, but July 18th. And when you get 8 weeks out or 7 weeks out, it's getting a little too far. Things can turn on you, and back to the volatile environment that we find ourselves in. So we're, head down, focused on what's happening in a week to 2 week to 3 week basis, back and forward to make the decisions that we're making.
Adam with Hannah News.
Yep. Good afternoon, Adam.
Good afternoon. I have a question about contact tracing. When you do make contact, are you finding that people are in fact quarantining and isolating themselves?
So in all honesty, when we make contact, some people know their test is positive, and some people we're the first person to tell them their test is positive. So in all honesty, we are telling them that and then going through bit by bit, what does isolation look like? What does that mean? We are emailing them information in whatever language they prefer with regards to that isolation, and then really encouraging them to give us those contacts. I think some people are very hesitant to do that. And I think they're worried about giving other people's phone numbers or addresses out. But in those circumstances, we're giving our phone number if they won't give contact information on how we can reach someone so that those individuals can call into us. But yeah, for the most part, people are really trying to follow this. Now, there are individuals that have a really hard time doing that. They may live in a home where grandma and grandpa live there, and there's no way to have your separate bathroom or your separate bedroom. And there are ways that we try to help them with that. There are issues around the state where some counties have actually been able to find RVs or apartments or other places, motels, where they can house individuals for the isolation time or quarantine.
Sheila Angola, WLKI.
Good afternoon, Sheila.
Good afternoon, Governor. How are you?
Fantastic. Yourself?
I'm great. Well, as you know, 4-H is something that's important to many Hoosiers. Several 4-H families in my region here in Northeast Indiana have posed the question to me, so I'm asking you. They're wondering why that there's a limit on actual 4-H activities at the county and state level, but rides and food booths are functioning as usual.
Are you talking the state fair time? Is that what you're questioning?
Both the local county fair and the state fair.
So I can't speak for all the counties. I know that from a state level, the concept of the carnival and the ride is still under discussion, and I'm going to have a time here shortly to talk to the CEO of the fairgrounds there about what may happen in August. But I do know I had a good discussion with the 4-H individuals, and they were really planning to make sure that that went forward. And their hope was that not very many counties would close down the 4-H part of their county fairs. And if they did close it down in a particular county, they were going to make sure that those young adults had the opportunity to go to another county and to show their animals or whatever they were doing with regards to 4-H. So I think they really had it planned so that we could still have them competing, just using social distancing and masks and making sure that they really cut down on the numbers of people that came.
And you'll have an update on the state fair next week.
Yes.
So see, we'll be here together. Okay.
Cameron, WRTV.
Afternoon, Cameron.
Hi, good afternoon, Governor Dr. Box. 2 quick questions. When we talk about the 4 guiding principles for reopening, you've kind of already turned things over to the local school districts to let them make their plans. Yep. So is there anything in those principles that could change school reopening? We're literally less than 30 days from some of our districts opening this month. Is there any, are they still planning to go, or should we prepare for something else? And then for Dr. Box, in that same realm, are we learning anything different about our students and young kids as they go back? Are they more susceptible, less susceptible? Is there anything we're learning new about what they could be at risk for, or putting their teachers or bus drivers at risk for?
Sure. I'm not going to buy you very much time. Yes, they still should plan to open and receive students in the facility for instruction. Coming up here, you said less than 30 days, so July, August time period. This is when the planning is occurring. And you might want to answer the second part.
Importantly there, we look at countries or societies that actually closed their schools in the beginning of all this pandemic and those that did not. And those that did close their schools did not see a decreased amount of cases nor an increased amount of an issue with their students or their young adults. So we really do feel very strongly that students can get back to school. That being said, our superintendents, our principals, school systems all across the state are working very, very hard to bring students back in the safest way possible. And we have been consulting with them across the state. We hired a liaison specifically for that. I've been working with Katie Jenner here with the governor's office, with the Department of Education. And I know that our local health departments have been very actively engaged at the local level also. When we talk about students, we at the very beginning thought that kids wouldn't get infected or wouldn't show much infection, and where they had minor infections, and that seems to be the case, is that they with their immune systems do clear this up for the most part pretty quickly. We thought they might be kind of the super carriers and infect everybody around them. We really haven't necessarily found that either. So what we do know is that there's a very small percentage of students, young adults, that can end up with a prolonged inflammatory syndrome, kind of a post-infectious syndrome, and that's the MISC that we've talked about. We still, in the state of Indiana, are only at 7 documented cases, and we've investigated about 19, but that's still something to be concerned about and something that we're looking for closely.
Jeff with the South Bend Tribune.
Good afternoon, Jeff. Thanks for joining us.
Good afternoon, Governor. Thank you for having us today. You've mentioned Elkhart several times, you and Dr. Box, in this press conference. Can you talk a little bit more about what role what's happening at Elkhart has played in your decision today to extend the order at least 2 more weeks? Are there other hot spots around the state that you can also identify here for us?
Yeah, you want to talk about, well, you weren't just in Elkhart. You were in, I think, Elkhart, Goshen, LaGrange. You were
Goshen. I didn't make it up to LaGrange this time. But I did meet with a lot of individuals from the communities that were from LaGrange. We didn't hold the state of Indiana back to a 4.5 just based on what's going on in Elkhart. I mean, that's an individual decision that they very much supported and wanted. Their elected officials, their county commissioners, the mayors, their local health officer, they did their mask mandate. So they very much realize the issues that they have going on. And this has been a consistent thing over the past 3 to 4 weeks that they've stayed high on their positivity. But there are other areas, and we see just a little bit of uptick in cases down in the Vanderburg area. We're still watching a couple of things that we've identified in the southern part of the state, where we had some community get-togethers that actually ended up infecting several people and brought numbers up in counties there. So we're watching all of that, but it really had more to do with the global look at the United States and the overall state numbers that we looked at.
Tom Davies, The Associated Press.
Hello, Tom.
Hello, Governor. How do you feel about the Indy 500 going ahead with possibly more than 150,000 people, and the state fairgrounds planning a month-long festival, even though the state fair has been called off? Don't those type of events run the risk of being super spreaders for the virus?
Well, you want to talk about the second half of his question, but I'll say that the IMS, not just, forever, but to date during this pandemic has been extremely thoughtful and thorough and fan-centric, especially when it comes to safety. We always think about this being a safe place for the drivers. Well, this year, they have just underscored time and time again, we're not having fans at the races this weekend. So they made the right decision for them, obviously, before we did. And I will say about the Indianapolis 500 in August, scheduled August 23rd, again, weeks away, but that is a massive piece of property. You can fit a lot of different sports venues and physically distance out there. But again, there's some time before we get there. I mentioned Dr. Dan, showed me that preliminary research, and if you're properly physically distanced and you're outdoors, it dramatically goes down by the tune of 19 times. So they'll make the right decision, and we'll support that. And he asked again about the state fair.
The state fair,
yeah.
Right. And I understand your question there, and that's why we are still in discussions about that. And I'll be talking with the CEO of the state fairgrounds as to what the plans are out there. Hopefully have an update next week for you.
Our final question is from Rob Burgess with the Wabash Plain Dealer.
Good afternoon, Rob.
Good afternoon, Governor. Made it in just under the wire.
So, this is for any of the doctors. I wanted to get your take on a study released last month that showed that COVID-19 antibodies faded from the patient's bodies rather quickly. I wanted to see how that relates to the results you've been seeing from the studies you've been doing. Does this potential lack of long-lasting antibodies mean that herd immunity won't be possible, even if we do eventually get to something like a 70% infection rate?
Rob, are you vacuuming while you're asking this question?
No, I'm using a different headset than usual.
Okay. I can take a stab at that. So I do know the study you're looking at, and for sure, as you see antibody levels start to decrease after an infection, you would start to worry a little bit about whether somebody's losing their immunity. The short answer to that is we really don't know yet. There's more to immunity than antibodies. There's also studies that look at T cells, which are a special type of cell in the body that is often there to help kill viruses, that those levels may be actually higher in people who have been exposed. So while for sure we're going to continue to watch the data on the antibody test as more and more of them are done, to this date we still don't know of any case that's been validated of anyone who has been reinfected, and we're now looking at about probably 4 or 5 months since this started. So knock on wood, we're going to have at least a period of immunity, but we need to watch the data and continue to do so closely.
Mask up, it's cool.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be Wednesday at 2:30 p.m. Eastern.